Chaulk, and I'm a graphic designer by trade, but we own a farm in, my husband and I own a farm, a small farm in central Ohio in Alexandria. And for 5 years we lived in Canada from 1997 to 2002 as legal immigrants. It was a job transfer for my husband. And we had some pretty miserable experiences up there as a function of dealing with the healthcare system that was provided by the province of Ontario. We lived just north of Toronto, and all healthcare in Canada is provided through the provinces to the citizens and the legal immigrants, which we were, to those folks. There's no option to go elsewhere for your health care. I know in Great Britain the health care can be provided by the state, so to speak, but there are also consultants that one can go to see if one would like to pay out of their own pocket, so that if the health care system provided by the government is quite bogged down, you have the option of paying to see a consultant, which is another physician, which actually alleviates a little bit of the overcrowding in the public system. But in Canada, that's not the case. When one is sick, when somebody comes down with something, when somebody needs treatment from their family doctors up there are great, and I can't say enough about our physician who looked after us in Canada. However, if you come down with some kind of a illness that needs a special treatment, an injury, some kind of a malady that's more than the family doctor is trained to deal with, that's where the trouble starts. In Canada, 15% sales tax is typical. That's what the sales tax was in the province of Ontario. A large portion of that went to pay for healthcare costs. Our personal income tax was also 53%. But funny enough, Canadians see their health care as free, and they'll tell you that they have free health care. Well, if you're willing to pay more than half of the money that you earn to the government, and if you're willing to wait weeks and weeks, perhaps months, for treatment, then I suppose you could call that free. And sometimes I guess the old adage, you get what you pay for, can be fairly accurate. It's not unusual for folks, when we lived there over the turn of the last century, to wait 10 months, and I'm not kidding, 10 months for a CT scan. And we knew of this personally. I can divulge, give names and dates. 10 months for a CT scan, because in Toronto at the time, a population of roughly 8 million people of the adjoining area, there were 2 to 4 CT scan machines, and I can't remember if there were 2 or if there were 4 for that entire population. And in Columbus, there's one at every hospital and every outpatient clinic, as you know, in Columbus, Ohio. But the government can only push their money so far. They've got to look after the transportation system, the highways. They've got to pay police officers. They've got to look after schools, and then all the universities are public, so that's all within the public coffer. So there's only money to go so far. Knee replacement surgeries are often 2-year wait, and I'm not kidding. These are people with chronic, serious knee pain with very debilitating disorders, and it's a 2-year wait, not because it can't be done, just because there's only so many facilities and so many physicians allotted and allowed to do that. Physicians are paid on a salary by the state in Canada, in the provinces. They are only really allowed, if you'll use that word, they're permitted to see so many patients a day. That's in their contract. They are contract workers of the government. If a physician sees more than that allocated number of patients per day, within a year's time, if he's accumulated more patient visits than he's allotted, his salary from the government is deducted. It's reduced, excuse me. So his per patient visit, instead of, say, getting $20 per patient visit, he might only get $17 per patient visit. So there's no incentive for a physician to see more patients unless, out of the kindness of his heart, he knows that that's his duty and his Hippocratic oath. There's no after hours for a doctor. If you call your physician after hours, you don't get the medical society and a page to talk to that doctor. your only recourse is to go to the emergency room, as they call it, the emerge in Ontario. So if you go to the emerge, the wait there is like what you'd expect at any hospital in a large metropolitan area, unless you're bleeding profusely. If your child has an earache, something simple the doctor could deal with over the phone. If you've lacerated yourself, need a few stitches, something the doctor could handle in his office after hours. That doesn't happen there. You're in the emergency room, often overnight, waiting and waiting for a simple procedure that must be done by a physician, but that could have been handled in a different way. So that whole system is really broken, and the current Minister of Public Health in Ontario has recently stated in 2010 that the system is broke, it's broken, and she doesn't see a fix. So I don't know why Americans could even imagine joining a system like this. Ontario pays for the education of many of its physicians, or it subsidizes it in their medical schools. And I know when we were there were hundreds and hundreds of applicants from all over Ontario colleges and universities to attend medical school, but there's only so many slots allocated. Let's say 125, and my numbers are a little loose, but the number available is much lower than the number of applicants that are qualified to become physicians. So since the government is paying for their education by large measure, largely sponsoring it, when these physicians do graduate and become certified, they are actually assigned a place to work. They may want to work in Edmonton, or they may want to work in Sudbury, or they may want to work in Ottawa. But no, the government says, we really need a physician in North Bay, or we need a physician up in the Inuit area in far northern Ontario. And that's where your options are, unless you decide to head to the United States. And as a matter of fact, when we moved back here from Canada, the doctor we found that was nearby, that was accepting new patients, was, can you believe it, from Ontario. We didn't know him from apples. He was a graduate of the College of Western Ontario, University of Western Ontario, and he actually knew my family physician up in Canada, and he came here in the mid-90s to practice medicine the way he saw fit. Again, my name is Sarah Chaulk, and I live in Alexandria, Ohio, and I really appreciate you listening to me.